In the name of God, most merciful, most compassionate, good afternoon. As part of his efforts following up the developments in dealing with COVID-19 crisis, His Majesty King Abdullah II, may God bless him, chaired a meeting today for the National Policy Council with the presence of His Royal Highness the Crown Prince, Prince Al-Hussein bin Abdullah II, God bless him. His Majesty listened to a brief delivered by the Minister of Health about the epidemiological situation in the kingdom and the steps the government is taking and the different authorities are taking in order to control the spread of the pandemic and to safeguard the health and safety of citizens. His Majesty stressed the importance that all comers through the borders should be subjected to the preventive measures in order to control the infection from spreading inside, and he stressed the importance of conducting studies to build permanent quarantine sites in the north, south, and center in order to receive any cases of emergency and to provide those sites with the infrastructure and the utilities, be it water, electricity, and etc. His Majesty instructed the government to develop effective plans to deal with the effect of the crisis on the state budget and to take the needed measures in order to guarantee the flow and seamless flow of exports. And he stressed the importance of benefiting from the competitive advantage of the promising industries like pharmaceuticals and medical supplies, and etc., and increasing their exports, the thing that contributes effectively to the national economy. The crisis cell at the National Center for Security and Crisis Management conducted a meeting chaired by the Prime Minister Dr. Omar Al-Razaz to discuss the main challenges facing the different industries and sectors and the future trends that are going to be followed in the context of the continued pandemic. We discussed resuming business after the public departments after Eid holiday, the developments in relation to the quarantine site at the Amiri border post, the methods to improve the back-to-back delivery at the border post, and also the third stage of repatriation plan. We also discussed the indicators that we're going to adopt in order to decide on reopening the industries that have not yet been opened, and that mainly depends on the developments in the epidemiological situation. I'd like to stress that the government gives utmost attention and care to the medical staff, and we are keen on supporting them and enabling them to fulfill their duty during this crisis. And we are keen on maintaining and not compromising their livelihoods. Having said that, the Ministers' Council issued a decision to disburse remunerations, monthly remunerations to the medical staff who are working during the pandemic. And we would like to stress that the decision to disburse remunerations to the medical staff during the COVID-19 pandemic is not a new decision. Rather, it was taken on February the 2nd, 2020, upon the recommendations of the Minister of Health and the approval of the Prime Minister. And we stress that these monthly remunerations are going to be disbursed till the end of this pandemic. May God bless you, bless this country and its leadership. May God protect you and the whole humanity from this pandemic. We're at your service and we Good afternoon. Today, there were 16 cases of COVID-19 in the kingdom, distributed as follows: 7 cases of contacts in Al-Mafraq, Al-Khanasri, contacts of the case in Al-Khanasri. 4 cases are lorry drivers at Al-Amiri border post, Jordanians. 3 are Jordanians coming from Malaysia. They arrived yesterday morning, and 2 cases in Irbid. And now we're investigating and tracing the infection, and we're investigating the reason for their infection. The epidemiological tracing teams in the governorates are tracing that infection. There have been 5 recoveries in the kingdom, 2 in King Abdullah Hospital, University Hospital, and 2 cases in Prince Hamza Hospital, and 1 in Queen Alia Hospital. The thing that makes the total number of patients under treatment 140 patients. Thank God there have been no deaths today. And There have been 3,500 tests conducted today. The thing that makes the total number of tests conducted since the beginning of the pandemic 144,365 cases. And in fact, today we would like to stress and reassure our our colleagues, the medical staff, that we cherish their efforts, we cherish their sacrifices. Just like the Minister of Media said on January the 26th, we recommended to the Ministers' Council to disburse remuneration to the medical staff should there be a pandemic. And indeed, the Ministers' Council approved that decision, approved that recommendation, and issued a decision on February the 2nd. And this is not to compromise, in order not to compromise their livelihoods. I am a doctor myself, and I understand how they feel. It's more of a moral appreciation and recognition of their efforts. We're not going to forget their efforts. They are our brothers in the fields. May God bless them and help them, help citizens, because they're working day and night combating this pandemic and in treating patients. May God bless you, bless this country and its leadership. Peace be upon you.